Welcome to series number 11 on our SCI educational series on enhancing patient safety. Bowel dysfunction following spinal cord injury is a significant safety concern that requires routine and skilled management. Due to neurological impairment, SCI patients are vulnerable to life-altering complications such as constipation, impaction, and autonomic dysreflexia, a potentially fatal hypertensive crisis. First, bowel dysfunction is critical because it affects nearly all patients with SCI due to the interruption of nerve pathways controlling bowel movement. Second, poor bowel management can lead to serious complications like a D, especially when bowel routines are not followed or impaction occurs, triggering severe hypertension. Lastly, implementing timely and appropriate interventions, such as a well-designed bowel program, reduces patient discomfort, minimizes hospital readmissions, and significantly improves quality of life. My name is Michael J. Orellino, your SCI nurse educator. SCI nurses must recognize bowel care not as a routine task but as a vital intervention that safeguards patient outcomes. This presentation outlines evidence-based practices to assess bowel function, prevent complications, and respond to emergencies. Empowering staff with this knowledge enhances interdisciplinary collaboration, patient dignity, and holistic recovery. This presentation aims to meet 3 critical learning objectives designed to strengthen spinal cord injury nursing care. First, understanding neurogenic bowel patterns, whether upper motor neuron (UMN) or lower motor neuron (LMN) is essential. Each pattern requires a different approach to bowel management. UMN injuries generally involve reflexic bowels, while LMN injuries result in areflexic bowels, requiring more manual interventions. Second, identifying effective assessment and prevention strategies is vital for recognizing complications early, maintaining patient safety, and preventing emergencies such as autonomic dysreflexia. This includes consistent monitoring, individualized care plans, and early interventions. Lastly, promoting a consistent patient-centered bowel care routine supports long-term health, autonomy, and dignity. Encouraging active involvement from patients and families in care decisions builds trust and compliance. These learning outcomes align with evidence-based clinical practices and support improved patient safety, reduced complications, and higher satisfaction among the SCI population. Effective bowel management begins with a thorough and individualized assessment. Determine the level and completeness of the spinal cord injury. This assessment identifies whether the patient has an upper motor neuron (UMN) or lower motor neuron (LMN) bowel, which dictates the appropriate care strategy. UMN bowels retain reflexes and may respond to digital stimulation or suppositories, whereas LMN bowels are flaccid and may require manual evacuation. Focuses on monitoring stool patterns. Nurses should document frequency, consistency using the Bristol stool scale, and any deviation from the baseline. This monitoring helps identify issues like constipation, diarrhea, or incontinence. Staff must assess for signs of abdominal distension or rectal impaction, both of which may signal a more severe problem. Autonomic dysreflexia symptoms, sudden high blood pressure, headache, flushed skin, and bradycardia, must also be promptly recognized and treated. By performing consistent, informed assessments, nursing staff can detect early warning signs and initiate appropriate interventions that prevent emergencies and promote safety. Prevention strategies form the foundation of effective neurogenic bowel management. Establishing a consistent and individualized bowel program is critical. These programs are designed based on the patient's injury type and preferences. A well-planned routine may include digital stimulation, suppositories, or timed toileting. Predictable schedules minimize incontinence and improve independence. Dietary and lifestyle measures such as proper hydration, high fiber intake, and physical activity are essential. Water and fiber help form soft, bulky stools that are easier to pass. Movement, even passive range of motion exercises, stimulates peristalsis and supports gastrointestinal motility. Emphasizes the careful use of pharmacologic aids. Stool softeners, bulk-forming agents, or mild laxatives can support regularity, but must be used judiciously to avoid dependence or electrolyte imbalance. Nurses should tailor pharmacological support based on patient response and avoid unnecessary medication use. These prevention strategies, when implemented consistently, enhance safety, reduce complications, and preserve patient dignity and comfort. Bowel-related emergencies, particularly autonomic dysreflexia (AD), demand rapid recognition and intervention. The first step is identifying early warning signs of AD in patients with injuries at T6 or above. Symptoms include sudden hypertension, pounding headache, facial flushing, bradycardia, and sweating above the injury level. Nurses must immediately halt bowel care and elevate the patient's head to reduce intracranial pressure. Second, institutional protocols must be followed during cases of impaction or severe constipation. This includes performing digital rectal checks, administering enemas, or using stool softening agents under guidance. Rectal manipulation should be done cautiously, as it can further trigger AD if not properly managed. The third point stresses the importance of collaboration. Nurses should alert providers for pharmacologic interventions, consult GI specialists if needed, and document all findings and actions. Working together as an interdisciplinary team ensures a swift, comprehensive response that minimizes harm and supports patient stability. The psychosocial consequences of bowel dysfunction in SCI patients are significant and must be addressed alongside clinical concerns. Bowel incontinence often undermines a patient's dignity and sense of control. Relying on others for bowel care can erode self-esteem and limit social interaction. Fear and anxiety surrounding bowel accidents can lead patients to avoid activities such as therapy, outings, or rehabilitation. This hesitancy delays recovery, restricts social reintegration, and exacerbates mental health issues like depression or withdrawal. Providing emotional support and engaging patients in their care plans helps promote holistic healing. Offering reassurance, privacy, and empathy during bowel care can significantly reduce embarrassment and improve cooperation. Educating patients about their condition and involving them in decisions empowers autonomy and fosters trust. Addressing the emotional dimensions of care ensures that patients are treated as whole individuals, not just as clinical cases. Ongoing staff education is fundamental to achieving consistent, high-quality bowel care. The approach involves annual in-service training. These sessions provide opportunities to review institutional protocols, highlight updates and best practices, and share lessons learned from past clinical cases. Training helps ensure staff remain competent and confident in their practice. Simulation-based learning offers hands-on experiences in managing scenarios such as autonomic dysreflexia or digital dysmpaction. Practicing in realistic but low-risk environments reinforces clinical skills, builds confidence, and sharpens critical thinking. Fostering interdisciplinary collaboration strengthens patient outcomes. When nurses, providers, rehab therapists, and nutritionists share observations and work from a unified care plan, patients benefit from coordinated interventions. Feedback loops allow continuous improvement by identifying challenges, suggesting changes, and measuring outcomes. A culture of education, teamwork, and shared accountability lays the groundwork for clinical excellence and patient safety. Sustainability is the key to embedding quality bowel care into everyday practice. The strategy involves monitoring patient outcomes, such as bowel movement frequency, reported discomfort, or emergency room visits due to complications. Tracking these indicators highlights trends, identifies gaps, and guides necessary protocol adjustments. Regular audits of documentation help ensure staff are implementing the individualized bowel programs as prescribed. Compliance reviews also reinforce the importance of accurate, timely, and complete nursing records, which are essential for interdisciplinary communication and quality assurance. Involving patients and families in education creates a collaborative care model. Educating them about bowel function, red flags, and the importance of routine can lead to improved adherence and shared accountability. Providing handouts, holding educational sessions, and using teach-back methods ensure understanding. Sustainability efforts are most successful when guided by data, driven by teamwork, and supported by continuous engagement with patients and caregivers. To conclude, Bowel care must be recognized as a pillar of patient safety and quality of life for individuals with spinal cord injuries. It is essential because it directly influences physical health and personal dignity. Proper management reduces the risk of impaction, autonomic dysreflexia, and hospitalizations. Early detection of bowel-related complications combined with evidence-based prevention strategies helps avoid emergencies and minimizes patient suffering. Proactive and consistent interventions make a measurable difference in outcomes. The success of bowel care programs relies on the dedication, collaboration, and vigilance of the interdisciplinary team. Nurses in particular are critical in carrying out daily routines, assessing patient needs, and responding to changes. Continuous staff education and communication across departments ensure alignment in care practices. Moving forward, a unified commitment to high standards and patient-centered care will continue to enhance safety, improve satisfaction, and elevate the standard of SCI practice. The references used in this presentation are drawn from reputable evidence-based sources, ensuring that the strategies discussed are grounded in the latest scientific research and clinical guidelines. By relying on these credible sources, we promote best practices in bowel management for spinal cord injury patients, which is crucial for enhancing patient safety and quality of care. Accurate, up-to-date information helps healthcare providers develop effective, individualized bowel management protocols. This evidence-based approach minimizes complications, improves patient outcomes, and fosters a safe care environment, ultimately contributing to the overall well-being of SCI patients. Thank you for your attention and dedication to advancing spinal cord injury care. Each of us plays a crucial role in protecting the safety and dignity of our patients. Your continued commitment to excellence safeguards the well-being of the veterans and individuals we serve. Your adherence to bowel protocols, attention to signs of distress, and compassionate care reflect the highest standards in nursing. Every single action, from documenting stool patterns to educating patients, contributes meaningfully to reducing risks and enhancing recovery. No effort is too small when it comes to patient safety. Let us move forward together, continuously learning, sharing knowledge, and working as a team. Advancing SCI care requires collaboration, innovation, and empathy. As nurse educators, staff nurses, and interdisciplinary team members, we are stronger when united in our mission. Let us continue to lead with purpose, serve with compassion, and set the standard for excellence in spinal cord injury care. Again, thank you very much.